Good afternoon, everyone. My name is Ceci, and I'm the Alberta NDP candidate for Calgary-Buffalo in the coming election, and I'm the official opposition critic for municipal affairs. And today I'm joined by an incredible future colleague of mine, frontline nurse and Alberta NDP Calgary Acadia candidate, Diana Batten. We're gathered here today on the traditional territory of the signatories of Treaty 7, and I also want to acknowledge the Métis people of Alberta who share a deep connection with this land. Diana and I are both here today in pursuit of better public health care for all Albertans. It's something Diana's devoted her professional life to, and it's something that is near and dear to me as well as an elected representative of this great city for over 2 decades. Part of the reason I first agreed to stand with Rachel Notley and the NDP in 2015 was their commitment to health care and specifically to cancer care. Rachel Notley promised to build the new Calgary Cancer Centre, and Rachel Notley got the new Calgary Cancer Centre started after decades of neglect from the Conservative governments. That new centre will be open next year, and should we form government in 38 days, we will make sure it is staffed and the health workers there are supported. And an NDP government isn't going to blame people who need health care. We're going to deliver public health care for those who need it. Danielle Smith has a different approach. She is endorsing a candidate in the riding of Livingston-McLeod who recently blamed Albertans for needing cardiac care. And Smith herself has blamed Albertans for getting stage 4 cancer. The UCP government's approach to healthcare has been a disaster, and their performance when it comes to cancer care is at the very center of that failure. We analyzed the data of a number of cancer surgeries performed in Alberta every reporting quarter since they took office. Not once did the UCP perform more cancer surgeries than were done under the NDP government that I was part of. And this decline in Calgary in cancer care comes despite a growing population in this province. In our last quarter in government, a total of 2,412 surgeries were performed. In the most recent third quarter report from Alberta Health Services, just 2,176 surgeries were performed. AHS sets targets for when these surgeries should be performed, and the numbers facing delays have gone up, unfortunately. Now, more than 40% of all cancer surgeries are being delayed. This is wrong. Albertans deserve better than they're getting, and it starts with public health care. Thanks, and I'm going to turn things over to Diana to say a few words.
Thanks, Joe, and thanks for your tireless advocacy for the whole city of Calgary over your 2 decades of service. I will be so honored, if elected by Calgary Acadia, to serve with you in the next Alberta NDP government. I have seen firsthand the chaos caused in our healthcare system by this UCP government. I have watched the horrible mismanagement and constant efforts to pick fights with the healthcare workers and leave our patients unsupported. It is why I've stepped forward to run with Joe and Rachel Notley. I believe Rachel and her team will deliver better public health care. I believe through our Family Health Teams initiative, we will deliver quality health care to 1 million more Albertans. And through this modernization of our primary health care, we will take pressure off our hospitals and identify diseases like cancer so much sooner. I watched during the COVID-19 pandemic as our emergency rooms were overwhelmed and as surgeries were delayed. And I watched people, my patients, be left in pain and agony. Now, this UCP government is trying to claim that the crisis is over. But stories we hear daily from our patients and from my colleagues tell us it's nothing but. And what's more, at a time when public health care so desperately needs better leadership, Danielle Smith moves to dismantle it. Calgary Herald columnist Don Braid wrote that Smith is getting Albertans ready to pay for health care with her health spending account. And Smith herself questioned in 2021 whether Albertans should be forced to pay out of pocket to see a family doctor. Enough said. It's time to protect and improve public health care. That's why I'm proud to stand with Rachel Notley and our Alberta NDP team. For Albertans fighting cancer, for Albertans seeking the help they need, we will deliver better care for you. Thank you.
All right, thank you, Diana, and thank you, Joe. We'll now go to questions. Just a reminder for those joining us on the phone to use the *9 function, and for those joining us on Zoom to use the raise hand function to get into the question queue. First, we'll check if there are any questions in person. No questions in person. We'll move to the phones. And with no questions, we'll wrap today. Thanks, folks.